Today, we're going to talk about the body's internal engine, the thyroid. We're going to dive into a tale of two opposite conditions, hypothyroidism and hyperthyroidism, that affect millions of people by throwing that engine completely out of whack.
I mean, have you ever had those days, you feel like you're just dragging, totally out of gas for no good reason? Or maybe it's the opposite, and you feel jittery and wired, and you just can't calm down. Well, that feeling, that sense that your internal speed is just off, that's exactly what we're talking about today.
And get this isn't some rare fringe issue. More than 12% of Americans will deal with a thyroid condition in their lifetime. That is a huge number of people. It's why understanding this is so important, not just for you, but for the people you care about too.
So here's our game plan. First, we're going to get to know the thyroid itself, the body's engine. Then, we'll break down what happens when it's running too slow with hypothyroidism and too fast with hyperthyroidism. After that, we'll put them side by side and we'll wrap up with the most important part, how you can take control. All right, let's get into it. Okay, first up, let's meet the main character of our story, the thyroid gland. You really can think of it as the control panel or the gas pedal for your body's entire metabolic engine. So where is it? It's right there at the base of your neck, kind of below your Adam's apple. And even though it's pretty small and shaped like a butterfly, its influence is absolutely massive. Don't let the size fool you. This little gland is a powerhouse that sets the pace for your whole body.
And I'm not kidding about its influence. I mean, look at everything it has a hand in. Your basic metabolism and energy levels, your body temperature, your heart rate, how you manage your weight. It even plays a huge role in your mood, your mental clarity, and even your digestion. It really is the master regulator.
So how does it do all this? Well, it mainly uses two key hormones, T4 and T3. The easiest way to think about them is like this. T4 is the big storage tank of potential energy, just floating around in your blood. But T3? T3 is the high-octane fuel that your cells actually use to get things done. That balance between storage and active fuel is absolutely crucial.
All right, so let's look at our first condition, which is what happens when that balance gets thrown off. We're talking about hypothyroidism. This is when the body's engine is just running way too slow.
The name gives it away, right? Hypo just means under or low. So in this case, the thyroid is underactive. It's just not making enough of those T4 and T3 hormones, and the result is your entire metabolism starts to slow way down.
So what's behind this slowdown? Well, the number one cause is a condition called Hashimoto's thyroiditis. And this is what's called an autoimmune issue. Basically, your own immune system, your body's security force, gets confused and starts attacking your thyroid gland by mistake, which damages it and makes it less able to produce hormones.
And when you think about a slow metabolism, the symptoms make perfect sense, don't they? You've got that constant fatigue because you're just not making enough energy. There's unexplained weight gain because your body isn't burning calories like it should. Feeling cold all the time, brain fog, even a low mood or depression. It all ties back to the body's systems being powered down. Okay, now let's flip the coin completely and look at the total opposite. Let's talk hyperthyroidism. This is when your body's engine is stuck in overdrive and just will not slow down. Yep, you guessed it. Hyper means over, or too much. The thyroid is overactive, and it's flooding your body with way too much hormone. This kicks your metabolism into hyperspeed, and basically forces all of your systems to work way harder than they're supposed to.
And what's so fascinating is that the most common cause is, once again, an autoimmune condition. This time, it's called Graves' disease. But instead of attacking and damaging the thyroid, the immune system actually creates these antibodies that stimulate it. It's like your immune system is putting a brick on the accelerator and never letting up.
So the symptoms here are pretty much a mirror image of hypothyroidism. With everything in overdrive, you see unintentional weight loss, even if you're eating all the time. You get a racing, irregular heartbeat. You feel hot and sweaty constantly. Anxiety, irritability, shaky hands, and that classic tired but wired feeling where you can't sleep. It's all because that engine is revving way too high. Okay, so we've looked at both sides of the coin. Now let's put them head to head and really see how these two conditions stack up against each other. Honestly, this quote just says it all. If you remember nothing else from this explainer, just lock this in. Hypo is too slow, hyper is too fast. It's the simplest, clearest way to keep them straight. And this table just lays out that contrast perfectly. Over on the hypo side, everything is slowing down. Metabolism drops. You gain weight. You feel tired and cold. Then you look at the hyper side, and it's the exact opposite. Metabolism is sped up, you lose weight, you feel anxious and hot. Every single one of these is a direct contrast, all the way down to their most common causes, Hashimoto's for too slow and Graves' disease for too fast.
But here's the twist. For all their differences, as polar opposites as they share some really important things in common. Both are often the result of the immune system going haywire. Both are way more common in women. And critically, both can seriously impact your quality of life, and both need ongoing medical care to manage them right.
So that brings us to the most crucial point. What can you actually do about it? Let's talk about the final and most important part: how to take control of your thyroid health. The good news is, getting a diagnosis is a really straightforward process. It starts with a physical exam. From there, it's a simple blood test to check your hormone levels. Doctors look at T4, that storage hormone we talked about, and also something called TSH. Think of TSH as the signal from your brain telling your thyroid to get to work. If your TSH level is super high, it means your brain is yelling at a sluggish thyroid. If it's really low, it means an overactive thyroid is telling your brain to just back off. And finally, antibody tests can confirm if it's an autoimmune issue like Hashimoto's or Graves'.
And the treatment goals? Well, they're perfect opposites, just like the conditions themselves. For hypothyroidism, where something is missing, the goal is simple: replace it. You take a daily medication to give your body the thyroid hormone it needs. But for hyperthyroidism, where there's too much of something, the goal is to reduce it. That can mean medication or other treatments to slow that overactive thyroid down. And living well with a thyroid condition really comes down to these three things. Number 1, medication compliance. You've got to take it just as prescribed. Number 2, regular monitoring. Keep up with your doctor for those blood tests to make sure your levels are staying in that sweet spot. And number 3, lifestyle. Focusing on good nutrition, exercise, and managing stress, all of that can make a huge difference in supporting your overall health.
So there you have it. We've talked about the engine, the too slow, the too fast, and the path to taking control. You have the knowledge now. The only question left is, what's the next step you're going to take for your health journey?